Hello, everybody. I've done this 4 times, and fourth time is the charm. I think we fixed all the issues. I'm not going to keep you a long time. This is Carol Copeland Thomas, but this is really important information. I'm talking about what's taking place right now with the shutdown, almost day 3 here in the United States, and Obamacare and tax premiums. So let me walk you through what's taking place. As we know, people have had access to Obamacare since 2009, so it's been quite some time, and there have been premium tax credits that are connected with that based on whatever state you live in. So the tax credits are the things that are now in jeopardy of being removed, expired, or taken out of the budget that is now a stalemate, and that's why the shutdown has taken place. So if those tax credits go away, if they expire, if they go away, it means that people who are on Obamacare, Healthcare Connector, whatever the name happens to be in your state, that means that your premiums are going to go up like a rocket ship. It's going to be very high, and it'll be very difficult for people to maintain their insurance, especially if they're middle class, working class, etc. And their bill goes from maybe $150 per month to $500 per month. So let me get into it, and I think we're doing well in terms of my internet. The Affordable Care Act, also known as Obamacare, offers premium tax credits to people who buy insurance on the healthcare.gov marketplace or whatever your state exchange happens to be. There are different names. Here in Massachusetts, it's the Health Connector. These subsidies reduce monthly premiums based on income, family size, and the cost of the local benchmark plan. Enhanced subsidies expanded during the pandemic further lowered costs for millions. So, again, made it affordable. People could keep their insurance and keep healthy. What happens if the subsidies are taken away? Well, if the enhanced ACA subsidies expire or are removed in the new federal budget that Congress is now stuck on, and that's why we have the shutdown that's taking place, millions could face large premium increases. Studies suggest average increases could be 75 increases of 75%, with some states seeing premiums to double. Um, Whatever subsidy, without subsidies, healthy people could drop coverage, leaving a sicker pool, which drives the cost up. So you could have people leaving because they can't afford it. They've been otherwise healthy. Then you have other individuals who are sick, and the prices go up, and it's just really a bad scene for everybody. Now, these ACA subsidies, this is important. They are different than Medicare. If you're on Medicare, this does not pertain to you. ACA subsidies apply only to marketplace plans, not to Medicare. People on Medicare, like those buying Part B or Medigap or Part D, are unaffected by ACA subsidy decisions. Medicare costs are set by Congress and CMS with annual adjustments. All right, so if you're on Medicare and you have subsidies, etc., this does not pertain to you. If you have company insurance and the company shares in the payment with you, that's not what we're talking about. We're talking about people who are on Obamacare and they have premium tax credits based on their income, etc. This pertains to you. Now, the problem is that the Democrats generally want to preserve or extend the ACA subsidies, arguing they keep coverage affordable and prevent coverage losses. The Republicans, on the other end, push to scale back or eliminate them, framing subsidies as costly federal spending. That is the problem, and that is why we have a shutdown. This makes ACA subsidies a recurring budget fight. So there's been this problem about Obamacare since 2009. The Republicans always want to do away with it, but they never have anything in its place. The Democrats want to keep it. And then this is what's happened because it's been around and it's, relatively effective. People don't want to give it up, even in red states. So, marketplace subsidies are used nationwide, but their impact is felt most in states with higher poverty rates, fewer employer based insurance options, or those who did not expand Medicaid. Ironically, many red states benefit most. For example, Florida, 4.6 million enrolled, nation's highest red state. Texas, over a million new enrollees in 2024, red state. Georgia, high enrollment growth, competitive political landscape, purple state. West Virginia and Louisiana, enrollment growth above 70%. I believe they're both red states. Ohio and Indiana, large increases despite Republican leanings. And California and New York, huge absolute numbers due to the population size. Both are blue states. Southern states without Medicaid expansions rely heavily on marketplace subsidies. So you're getting my point. So pay attention to what's taking place with this shutdown. We have no idea how long it's gonna last. One of the principal issues deals with these subsidies and other issues regarding health care and other services that are rendered. So again, red states and purple states often depend more heavily on subsidies than blue states. Blue states still benefit, but many cover their lowest income populations via Medicaid expansion, not Medicare, Medicaid expansion. And the political irony is that leaders most opposed to the ACA often represent states most dependent on the subsidies. Therein lies the dilemma. Therein lies the problem. And we all need to pay attention whether you have great insurance because your state is going to be impacted one way or the other. We're really concerned about other issues with this budget that both sides are fighting about because of costs that will go up significantly in various areas. And those who are billionaires they'll reap the benefits if it goes ahead the way it is. So I wanted to get that out. I did. I'm glad that the live stream is working. I had to do some things in the back end. Please join us in a short while at 11 a.m. Eastern on October 3rd, Friday, October 3rd. That's our US UK Summit on Race. We have a great speaker, Dr. Kai Inde Andrews from the University of Birmingham, the first Black Studies professor in all of the UK and probably Europe. And I'm going to give my response. We have so much to share with you at the US UK Summit on Race. Thank you so much. Take care. We'll see you soon. This is Carol Copeland Thomas. You can go to mssconnect.com to register for the US UK Summit on Race. Pay attention to what's going on with this shutdown, with the budget, and particularly with these health issues. See you later. Bye-bye.